my name is Dr. Michael Bahk, and I'm a fellowship-trained orthopedic surgeon at Southern California Orthopedic Institute. And I specialize in sports medicine, joint replacement, and arthroscopic surgery. In this video, I will be discussing rotator cuff tears and treatment options available. The rotator cuff is a set of 4 muscles with tendons that surrounds the shoulder ball and holds it in the shoulder socket. With any arm motion, the rotator cuff is working to keep the ball in the socket. In some ways, it is the heart of the shoulder, constantly beating or working to keep the shoulder joint centered. The names of the rotator cuff tendons are supraspinatus, infraspinatus, teres minor, and subscapularis. Without the rotator cuff, people will often complain of pain and difficulty with overhead motion. A rotator cuff tear occurs when one of the tendons breaks down or tears away from the bone. It can occur with the daily activities of life as the shoulder wears out over time, but can also traumatically occur in sporting events or accidents. Rotator cuff tears are marked by pain, classically upper arm pain. Although the rotator cuff is up here, the rotator cuff can and typically will refer pain lower onto the arm. It is typically worse with shoulder motion, particularly overhead motion. It can also wake people up at night and prevent them from sleeping. We like to tailor the treatment for rotator cuff tears specifically for that patient. The treatment of rotator cuff tears can be very variable. Starting at the very far end of the spectrum, more conservative measures that really help patients feel better are physical therapy to strengthen the surrounding muscles, anti-inflammatory medications, pain medications, and cortisone injections, which can help them feel better with less pain. These options don't necessarily fix the torn rotator cuff tendon, but they can provide enough relief where the patient can be happy with it. Particularly for partial rotator cuff tears, these simple conservative measures can help 60 to 80% of patients. For tears that are more significant or that are problematic, we can recommend arthroscopic rotator cuff repairs, where we actually stitch or sew the tendon back onto the bone through minimally invasive arthroscopic techniques. This is performed as an outpatient surgery and can help people get back to their normal lifestyle. If the rotator cuff tear is very big and irreparable, then we can recommend arthroscopic reconstructions using allodermis, where we basically have a patch of tissue, donor tissue, that we can use to bridge or augment rotator cuff repairs. In other words, we can reconstruct or remake the rotator cuff with donor tissue. And for some people, this can be a godsend and can help patients who have no other options. Arthroscopic surgery is a great option for rotator cuff repairs because it's minimally invasive. It doesn't detach any muscles, there's small incision, the rehab is quick, so there are a number of advantages for patients with arthroscopic surgery versus traditional, open, or bigger incision surgeries. For repairs that are irreparable, and for patients who have shoulder arthritis, a reverse shoulder replacement, where we replace the shoulder joint with a new or specialized prosthesis, is helpful for patients because it takes care of the pain and gives them back their function. After arthroscopic surgery for rotator cuff repairs, we typically use an ultrasling or abduction brace for 4 to 6 weeks. Our job is to fix the tendon to the bone, and then we have to wait for it to heal. And it takes a solid 4 to 6 weeks of good healing to take place. After those first 4 to 6 weeks, we transition to formal physical therapy. We help get your motion back and strength back subsequently. Histologic studies show that maximal tensile, or the amount of healing that takes place, reaches its peak at about 3 to 4 months after a repair. So that's when we typically begin strengthening and doing more aggressive activities. We consider full recovery about 4 to 6 months after the procedure. It's a little variable, but roughly, with patients still receiving benefits and improvement even up to a full year after surgery. To learn more about rotator cuff tears and treatment options, please visit our website at www.scoi.com. Thank you very much.